All right. Well, good afternoon, everyone. I see we've got a lot of folks joining. A few more will be coming in, but we're going to go ahead and get started. I'm Jake Loesch, Executive Director of the Citizens League, and we've been really proud to partner with the Center for Rural Policy and Development for the last 3 or 4 years now on this interconnected series and really focusing on how we can bridge rural and urban divides and have these important conversations. So glad that you're all here with us today for this important conversation about youth mental health with this really fantastic lineup of panelists. I think we're in for a really important discussion. Citizens League, if you're not familiar, we are a nonpartisan, nonprofit organization that's been working in Minnesota for more than 72 years. We focus on civic engagement and empowering people to be active in public policy. And one of the ways we do that is through educational events just like this, what we're all here for today. Citizens League also works with partners on public policy research projects, and we run the Capital Pathways internship program, which is a unique opportunity for BIPOC college students to have real-world experience with organizations working at the state capitol and in our state government. We're proud to be celebrating the 10th anniversary of that program next year, and to date have worked with more than 300 students and more than 100 host organizations. We're really proud of that program's success and look forward to continuing it. You can always find more information about events like this and other Citizens League events at citizensleague.org. And with that, I will turn it over to my counterpart, Julie Tesh at CRPD.
Great. Thanks so much, Jake. It's a pleasure to have you all here today. And like Jake said, this is our third or fourth year doing this interconnected. This all actually started in a coffee shop at a Caribou Coffee in Burnsville several years ago. Conversation between myself and one of the previous executive directors at Citizens League. And it's wonderful how this has really blossomed. And we're really excited to have all of you with us today. You know, there's so many issues that we face in this world, and so many of them are shared issues between rural and urban. And mental health, specifically rural mental health, is one of those. And so we're very happy to bring this webinar to you today, and also to bring you a new report that we are releasing right now on rural youth mental health specifically. And so you'll be able to find that at our website, ruralmn.org. And for those of you that aren't aware of the Center for Rural Policy and Development, we are a nonpartisan, not-for-profit policy research organization, and we are dedicated to benefiting Minnesota by providing its policymakers, whether that's state legislators, county commissioners, city council members, with unbiased information and evaluation of issues from that rural lens, because things look different from Minneapolis than they do in Red Lake Falls. So that's where we provide that lens. And again, you're welcome to check out our website, ruralmn.org. And I'm not going to take any more time because I'm excited to introduce our head of research and operations, Marnie Werner. She is our lead researcher on mental health topics and also on child care. She's been spending a great deal of time on this topic, and we had to come to an agreement that she was going to stop on where she was, because this is such a huge topic. There's so much to talk about, and this is a laying the table, setting the table so that we can go deeper into this. So this will be a topic for us for research for at least the next 3 years. So with that, thank you, everyone. Oh, I should also mention, if you have questions, please utilize the chat or the Q&A. Actually, the Q&A, but you're also welcome to chat with each other as well. We typically do have a robust conversation. This is being recorded and will be up on our Center for Rural Policy and Development website or on our YouTube channel within the next 24 hours. You're welcome to take a look at that and share it as well. So with that, I'm going to turn it over to Marnie.
Okay, thanks. Yep, got the video on, got the audio on. So let me share my screen and okay. Okay, I hope that all looks good. So let me put this in show. Okay. Yes, Microsoft. Okay, there we go. So yeah, like Julie was saying, this it was becoming apparent fairly quickly that this was turning into a larger and larger report. And so we instead decided to just go back to the original question of where do rural parents get help for their kids? Um, this all started out over a year ago when we were doing our research agenda survey for 2024. And the question of children's mental health was a huge topic. And so we just put, where do parents go for help in rural areas? And that was the top vote getter for the research agenda survey that year. As we found out through the research, the mental health system is fragmented, especially for kids and especially in rural areas. And we know there's a problem with children's mental health. It's been deteriorating for at least 10 to 15 years. You can see it in the statistics. And in rural areas, accessing mental health services is an issue. We have the longer distances. The long wait times are a problem anywhere, rural or urban. There's a lack of information just because there's plenty of information out there, but information just doesn't travel instantly. And there's a desire for anonymity. People don't necessarily want all their neighbors to know that their kids are seeing a therapist. And in rural areas, especially, they're just getting to be fewer and fewer people in the mental health field. We did a study on that last year about the workforce problems with that. And so we know it's a big problem. And so we decided, let's just focus on what can parents do now. And so here's a quick refresher of just what exactly is going on. Um, this chart is showing the instances of self-harm among children and adolescents. And you can see how this is nationally, and you can see how it's been rising since around 2009, 2010, especially for girls. It's been a huge, everything is just getting more difficult. And you can see how how it's really started shooting up after the pandemic, just got worse. And then here's some stats on emergency room visits in Minnesota. Um, the data was divided into 4 large groups: anxiety, conduct disorders, depression, and suicidal ideation. We have girls on the left and boys on the right. And you can see that the primary reason for the emergency room visits, you can have more than one reason for an emergency room visit. This just shows the primary reasons, and you can see how suicidal ideation has just really gone up, especially for girls. The other lines look like they're going down. That could be kind of an illusion because maybe they're not, maybe they weren't given as the primary reason. But depression, anxiety often go hand in hand with suicidal ideation. So they may have very well have been diagnosed on the same visit. And so you can just see how that's changed over the years. And I should say these are cases per 100,000 population. So you can see how they've gone up. And so for mental health services for kids and for adults, we have what's called the continuum of care. And for kids, it's a little different than from adults, but it goes from promotion and prevention at the very mildest part, form at the beginning, even before a child has any problems, is demonstrating anything. Promotion and prevention are great for making sure that, nothing does happen. And then when a child does start having symptoms, we have CTSS, which is a suite of services that that the state has certified and help for kids and their families. Then you have school-linked mental health services, which we'll talk about a little bit more. You have crisis intervention with things like mobile crisis teams and crisis phone numbers. Then you have intensive mental health services. And then you have recovery and rehabilitation, and that's after a child is out of, say, an inpatient treatment center or something, and there's things to help the child get back into their normal way of life. And so this is what we call the continuum of care. And a kid can get on it anywhere along this continuum, but the earlier they can get on it, the better, because mental health issues and illnesses only escalate the longer they're untreated. And so the sooner you can get on it, the better. And so, as I mentioned, there's a workforce shortage. You can see from the map, this is a map of psychiatrists and advanced psychiatric registered nurses and where they are around the state. And many are retiring, and it is difficult to recruit people to a rural area if they haven't actually, lived in a rural area already. And there's some difficulty recruiting people into the field, and difficulty getting people licensed after graduation. These are all kind of headwinds that are being faced with rural areas, and rural areas, but everywhere in general too, but it's just more pronounced in rural areas. And so what are parents supposed to do? Well, what we ended up with in this report was, instead of just going over a problem that we already know is a problem and pulling out all the statistics, we started to realize as we went through the research that there were a few things that were really kind of jumping out as things that would actually help right now. And so the first one of those was parents educating themselves on kids' mental health, what it is and what it isn't. What's the difference between mental health and mental illness? What do symptoms look like? When should you be concerned? This is all about getting help earlier if you think there's a problem, if something's going on. Remembering that 988 is a mental health resource and not just a suicide line. And there are websites at the Department of Health, at the National Association for Mental Illness, Minnesota, and the Minnesota Association for Children's Mental Health. They have a lot of stuff on their sites, that are a lot of information on there. And there are many other organizations too out there. And then just learning about the risk factors and protective factors. The risk factors are those negative things that can push a child and push them towards mental illness. And the protective factors are the factors that can help protect a child, like a stable family environment and good structure and friends, having friends and things like that. Those are all protective factors, whereas an unstable home life or no friends and loneliness, those are all risk factors, and those are all mentioned and listed out in the report. And then the second thing, here they all are here. Yeah, so you can see here are the risk factors and the protective factors. Their individual characteristics, family characteristics, and then issues in school like peer rejection, school violence, poverty, poor academic achievement. These are all things that work against a child and work against their mental health. And then protective factors are things like presence of mentors and support for development of skills and interests, academic achievement, problem-solving skills, engagement and connection in school with peers, in athletics, employment, religion, or culture. Those are all things that will help a kid develop resilience. So when they do face tough times, they can come through it without too much difficulty. And then the second thing we found that was really interesting was the idea of behavioral health integration into primary care. And that's a long title, meaning that just having a therapist in the regular clinic. Mental health is often been siloed off to the specialty clinic. And so you'll go to your regular doctor at your regular clinic, and that's the primary care clinic. But then if you want to go see a mental health person, a mental health therapist, you have to go to, the specialty clinic that it might be in town, it might be a half an hour away, it might be an hour away. There are some things where the insurance, if your insurance doesn't cover anybody local, you may be traveling quite a distance to get to a place. behavioral health integration is a situation where the mental health therapist is right there in the clinic. And so doctors can check to see if the issue that's worrying you about your child is physical. And then family practice doctors can treat non-complex cases like depression and generalized anxiety disorder. With behavioral health integration, it has a lot of, excuse me, a lot of wins to it. The doctor can bring the therapist in to meet you and your child right while you're there at your appointment. And so they connect with the therapist sooner instead of having to wait, 4, 5, 8 weeks to see someone. There's a team approach that brings together physical health and mental health. The warm handoff creates a personal connection that makes it more likely that this relationship will go on. And being at the primary care clinic helps keep things anonymous because then people don't know why you're there. You could be at the clinic for any kind of regular kind of checkup thing. No one needs to know it's about mental health. And then the third thing that was really interesting was school-linked mental health services. So most Minnesota schools already have mental health care providers already in place in the schools. And they can help kids a lot, even the kids that they're already seeing as clients, or even kids that are just having a rough day. And so most Minnesota districts have therapists in their schools, or they're available by telehealth. Minnesota School Linked Mental Health Services grants help pay for services for uninsured and underinsured kids. School's a familiar place. It makes it easier for them to meet with the therapist, and therapists can work on ways to keep things anonymous so nobody needs to know that your child is going to see them. Meeting at school helps parents who would otherwise have to take time off during work to take their child to an appointment. And this, of course, gets to be a problem, especially if, say, the appointment is an hour away, or if if the prescription for therapy is many weeks long. Having to take time off week after week like that can be pretty trying for the parent and their employer. So it helps with that it's right there in the school. And one thing is that it may be easier for parents to not keep in touch with their child's therapist because the child is right there in school and the parents don't have to be directly involved in getting the child there. So the therapists work to stay connected to their clients and to their clients' families. And so the takeaways on this report were really that children's mental health has been deteriorating for at least the last 10 years, and the pandemic really made things worse. It didn't necessarily increase the number of kids having problems, but it made the problems that kids were already having worse, and it maybe brought out and accentuated issues that kids were already having that nobody had noticed yet. And so accessing mental health services in rural areas has its own set of challenges, as we talked about, with distance and transportation, conflict with parents' jobs, concerns about anonymity, long waiting lists. And so we have these 3 opportunities to help parents: educating yourself about children's mental health, talking to your child's regular doctor, and then talking to your child's teacher, because there's a good chance there's a therapist already in the school. And so that's just a quick overview of the report. And now I will turn it back over to our moderator, Kate Raddatz, who is with McClung PR, and she will take it from here.
Thanks so much, Marnie, and good afternoon, everyone. Thanks for joining us here today. I'm Kate Raddatz. I'm the Director of Public Relations and Communications at McClung PR. We work with the Center for Rural Policy and Development. I'm very grateful to be part of this discussion today, a deeper dive into the issue of mental health in youth today in Minnesota and really the country. I want to start off by introducing our panelists. And so if you are a panelist, you can go ahead and turn your cameras and sound on. when I call on you, if you can just go ahead and tell everyone just a little bit about yourself, and then we will jump into questions. First, we have Sue Abderholden, the Executive Director of the National Alliance on Mental Illness of Minnesota. Sue?
Hi, everyone. So you just heard who I am. And I came to NAMI in 2001. So I've been here a long time. I'm also a family member and work a lot on public policy, especially related to children's mental health issues.
Great, thank you. We have Dr. Sara Gonzalez, the Clinical Director of Psychological Services at Children's Minnesota.
Hi, everyone. I'm very happy to be here. Like the introduction said, I'm Dr. Sara Gonzalez. I use she, her pronouns. I've been with Children's Minnesota since 2019, now serving as the Clinical Director of Psych Services and operating also as a pediatric psychologist embedded in our specialty clinics. And very happy to be here.
Wade McKittrick, Superintendent of Montevideo Public Schools.
Good afternoon, everyone. Happy to be here and excited to visit about what's being done across the state in Minnesota.
And Feven Tesfaye, a junior at Burnsville High School and a Minnesota Youth Council representative for Congressional District 2.
Hi, yes, I serve on the Minnesota Youth Council and work closely with the Mental Health Committee, and just understanding what the youth perspective around mental health is and trying to convey that.
And I may call on Marnie Werner, who you heard from as well, if something more specific to rural or the report comes up. So just final reminders, this is being recorded. I do have some questions I have prepared I'll jump into, and I will be monitoring the questions coming in. I see there's already a lot of chatter there, so I will be sure to be mindful of that as well. So let's jump right in. First, I'd like to ask all of you, when we think of mental health today, it's broad, right? And so I guess when we're talking about mental illness that we're seeing in today's youth, are there specific issues or specific mental health issues we are seeing more today in youth, or ones that have been the most concerning in recent years? Maybe we can start with Sara, Dr. Gonzalez.
Yeah, I think as Marnie mentioned during the introduction, anxiety, depression, suicidality are at higher rates, more than we've ever seen. But I will want to note too that a population that often gets underserved are youth on the autism spectrum or those with complex medical needs. And so we really need to kind of think about how we serve those complex needs that might even have difficulty accessing in the metro urban areas.
Sue, are you able to add anything onto that when we think about today what you are seeing?
I would agree. Depression and anxiety is huge, but I would say looking a little bit into the future, with the legalization of cannabis, we might be seeing more young people developing psychosis, and that's something that we're going to need to watch out for. And I think it's important to note that 50% of all mental illnesses emerge by the age of 14. So we tend to think of this as an adult issue, but it's really a children's issue.
We, one of my questions I have, it talks about, we talk about the importance of early intervention. You mentioned that most mental health issues show up by age 14. Parents are trying to do the right thing. They're trying to get their children help. What do you tell families? At what point should they be concerned, or when should they be reaching out to their pediatrician or whoever it is is this just normal childhood behavior, something they're going through? Or at what age do you say, hey, no, this maybe isn't normal? Or is it a case-by-case basis? Maybe, Sue.
I'll just jump in. Sorry, it is kind of hard to figure out who's going to answer first. Minnesota was actually the first state in the country to require teachers to have continuing education on the early warning signs of mental illness in children. And I think that that's been important, so that they're looking at things that they're not necessarily behaviors, but symptoms, which I think is important. And I think from our perspective, as a layperson's perspective, is every teenager is going to get mad and slam the door or stay in the room or say, no, I don't want to do band anymore, or, track or whatever, but it's the intensity and the length of time. So if that's, every day for a month, yeah, I would be pretty concerned. If they're isolating themselves, again, not enjoying things that they once did, not connecting with friends, those are all, I think, pretty big warning signs.
Thank you. And Feven, right at the beginning, we talked about just the prevalence of this. What is something you hear, among youth of how prevalent is this? And do people talk about it, or is there really still that shame and people don't really talk about if they're struggling?
Yeah, it's definitely a very common thing, especially during the school year when we're just constantly hit with more work and more things to do. And I think there is still kind of a stigma around it, and sometimes people are too ashamed of actually seeking out the help. And trying to destigmatize that is still in the process as more and more students come out and try to speak out about it. I've seen in multiple occasions people being made fun of. So I think it's definitely there.
And since this is the interconnected series where we look at similarities and differences in urban and greater Minnesota, what do we know about the state of youth mental health, as a whole across Minnesota, and what challenges, I would then say, what challenges are unique? Are there challenges that are unique to rural Minnesota more to within the metro? Wade, maybe I could start with you. Are there unique challenges there that maybe are specific?
Well, yeah, I think when you think of the rural communities, a couple things really pop out, Kate. First of all, that feeling of isolationism when you get into some of the further out of greater Minnesota, the resources aren't quite as available locally as you would see in the metro area. So that feeling of, one, I don't know what I'm feeling, but two, I don't know how to get help, really comes into play, I think, into some of greater Minnesota. And then just some of the lower numbers when you're dealing with density rates that are lower in greater Minnesota, you can really get that feeling. Kids can get that feeling of, am I the only one that's dealing with this? And when you feel like you're the only one, it becomes a barrier to seeking out some help.
What are some of those barriers? You mentioned that is an issue. What are some of the biggest barriers that are preventing parents there from getting their children help?
When you look at first of all, when you just look at access, where's our therapist accessible to families and to kids? I know we've talked a little bit in the introduction about school-linked mental health and therapists in every school, but I don't think that's a reality in greater Minnesota. There's access to school-linked mental health, but with a shortage of therapists, organizations like the Woodland Center in greater Minnesota, they're having difficulty finding those therapists to be in the rural communities. For example, in Montevideo, as an outstate school, we went without a school-based linked mental health therapist for over 3 years. And that's because they couldn't find a therapist to move into those areas. So that access can really become a barrier. The second thing is I think Marnie hit on, is parents having to leave work to pick up their kids, to drive a distance to a therapist, and then drive back. They're missing work that can create issues for them and their economics. It can also create barriers and issues with students missing school, as it increases absenteeism in order to access the therapist. So those are some of the common barriers that I think schools in greater Minnesota are facing, kids are facing, parents are facing, that make access difficult.
What efforts are being made to educate rural parents in rural Minnesota and communities about children's mental health? And how are these efforts, addressing the stigma surrounding mental health? Sue, can I ask you to weigh in on that?
So there are organizations like ours, Minnesota Association of Children's Mental Health, that do provide education to families. And frankly, with online trainings now, you don't have to worry about where it is. I know not all of greater Minnesota is covered by broadband, but many places are, and that is a chance to do that. We have seen in schools, the school social workers providing, information as well. So I think those are all kind of places that people can go to find that help. And of course, we have children's mental health collaboratives throughout the state of Minnesota. And a lot of times they're working with, with the schools and public health and even juvenile justice to make sure that families know about mental illnesses, about supporting their child's mental health, and the resources, while limited, that are available in their community.
I'm trying to go back through because I was seeing some questions come through at the beginning. I can come back to it. I'm trying to scroll through all of them. But, when going back to the early intervention, say you are a parent who has concerns. Dr. Gonzalez, what does that look like? What do you tell someone? Who do they go to if they have? Is it their pediatrician? Who is the best person to go to if they have just an initial concern?
That's a great question, and I think that accessing the pediatrician, and we are talking about integrating behavioral health into your primary care clinics and broadening that. At Children's Minnesota, we're also getting a little bit creative with an effort and initiative called Clinic in the Classroom, where we're connecting with school nursing staff across all of the state, not only to teach about medical concerns and how to triage those at school, but also add in the component of mental health and how school nursing staff can also be light for, students coming into their offices not feeling good, or if they're noticing something in their schools. So again, I think that plug for, yes, if you're seeing changes in functioning for your child, impacts in sleep, in eating habits, connecting with their peers that are of concern, reach out to your pediatrician, but also the people that you trust in your communities, which are in your school nursing staff, school psychologists, school counselors, social workers. So resources there.
Wade, what would that look like in a school setting? Is it where do students go if they have concerns and maybe they don't feel comfortable sharing at home, or does the school keep an eye out for that? What does that process look like?
A great question. We, I think our teachers and staff have gone through a lot of training just to be able to recognize early onset pieces or symptoms. May or not be related to mental health issues, but at least to raise awareness. And then that communication with parents of what is that available service to see, to be able to connect with the parents and find out, are you seeing these same things at home? Are you seeing any of these type of symptoms that they're a little bit different, but they may not be seen as really large issues at home, but minor things that are popping up over time, and to provide them with in our district, we've made a concerted effort to work with our private industry to put therapists into every building, and to make sure that parents are aware that there is that connectivity that we can have on a proactive standpoint within the schools. If you want somebody just to meet with, visit with, probe, for lack of better words, on where kids are at, we can do that. And those therapists can turn around and make recommendations that as a school, we would typically be able to make.
Thank you.
Just add on to something that Wade said, bringing both the family perspective and the education perspective together is so important, because you might have, for example, a child with high anxiety, but really is focused, have to be good in school. And so they're focused all day and they come home and they explode, right? And they know it's a safe place to explode. And then you can see it the other way, where a child is really causing a lot of problems in the school, but not at home, because the parents have figured out how to adapt and accommodate to that child. And so it is really important that you bring the two together to really get the whole picture of what's happening with that child.
Thank you. I have a couple of questions from people tuning in. First question, I think I'd like to ask all of you this one. It is, how much does our current political discourse have on our children today? Is that contributing at all to the rise in these trends? Feven, maybe I can start with you, with, especially now, right? We have an election coming up, and very, very politically charged, right? And how much does that impact youth?
I think there are two types. There's types of students who are more involved in the different political aspects, and then other students who are not as much. But for the specific students who are keeping an eye on different political candidates or news, as it's pretty much everywhere you look, I think it obviously has a very negative impact of knowing that the future and the spiral thoughts of what happens when one candidate wins or the another one doesn't. So I think the continual political aspect of the world definitely has some issues and creates problems for different young people.
Sara.
I think Feven's comments are very astute, right, in that it weighs differently for different people, but I'm seeing that in my patients too, having a larger, I guess, discourse, even in the course of therapy, of how their future will look with housing instability, accessing jobs, and what that looks like for them. There's more I guess, a heightened sense of competition for what happens or what success looks like post high school, that I'm seeing an increase in the young people that I'm working with that I saw when I started working with kids. So I think it's ever present.
Wade.
I think the political world, the political charging just underscores maybe even a bigger symptom or a bigger issue. I think it's just a symptom of the fact that we're living in society right now that just seems to be angry. That we've lost a lot of that ability to compromise and have discourse, be able to agree to disagree at times, and that I think kids are seeing that when the adults are not able to get along inside a room, what kind of example are we setting and we're teaching for the kids so that when they turn around and model that same type of behavior, it leads to negative impacts. And so yeah, politics is politics, and it's not pretty, but I think the bigger piece comes with adults and what we're doing to ensure that kids have a look at what normal relationship looks like as far as how we treat one another, how we interact together, and how we create safe spaces for one another, that we don't always have to agree, but we treat each other civilly.
Thank you. And Sue.
I think it has a huge negative impact on our youth, because we promote civic engagement, right? But then when they see what happens when you do engage, it's just not okay. And I will also add that it also depends on the topics at hand. So we know that some of the language that's being used around LGBTQ community is really detrimental to some of our youth who are hearing some really awful things. Maybe they're, questioning, their sexuality and identity. And if they're starting to believe, no, I'm a gay youth, and then they're hearing these kinds of really awful statements, that makes it really difficult for them, and they really take it to heart. So I would agree, we need to, as adults, model the behavior that we want to see.
Thank you. And I did see someone asked a question about a topic that you can't ignore when you are talking about youth mental health, and that is social media. Just this past summer, the U.S. Surgeon General released an advisory concerning social media and youth mental health. That was this past summer. He called on Congress to require warning labels on social media platforms. Feven, I'll ask you, how tricky is that balance, right? Of kids, teens want to be on social media, kids want to be on social media, but what have you seen in terms of the impact? What has your experience been, and the experience in speaking with other youth of how much of a difference that does make in the comparison factor and just the impact on mental health of today's youth?
Yeah, social media is a very tricky area because if parents do restrict their child from social media, then that child will feel left out because so much of day-to-day life for young people today occur on social media. But on the other hand, social media, if not handled carefully, is a very negative space. So in my opinion, I think there are some students or some young people who can handle social media very well because at a young age, they were taught the good things about the digital space and then the bad things. But On the other hand, there are other students who have never heard of good habits when going on social media platforms, and that negativity and the relationship with social media greatly impacts their mental health as well.
Thank you. Dr. Gonzalez, what are you seeing and or what data do we have on this?
Yeah, so research is showing that if kids are spending more than 3 hours on their screens a day, that can double the risk of mental health concerns, right? And so while this is a hot topic, and there's many reasons why we would want to give children, even young children, a cell phone, right? For safety, communication, medical reasons. Sometimes cell phones are used as medical devices. There's no really a specific age where it's appropriate, but really for families to be mindful of, I would say, quantity and quality of the use, right? So how the phone will be used, if your child knows how to stay safe online and having open discussions about what that looks like, and then the amount of screen time that we're accessing, since we know that that's also what increases the mental health concerns.
If I can just add, it definitely the amount of time. You also have to think about when, before cell phones were, always in schools, right? If you were bullied at school, you went home and you shut the door and you got a respite from that bullying. You don't get the respite from that bullying anymore. And so that really creates, I think, greater trauma within that child. We do know that if we want to look at the good is for LGBTQ youth. They can actually connect to other youth and feel that they're part of a community, which they might not feel, especially, frankly, in small towns and in rural parts of Minnesota. But I think generally, I agree with what everyone has said. We probably should limit it somewhat, put those phones away, at dinner time, even when watching TV, so that you're not multitasking and pulling your brain in different directions. But we have to remember the impact of bullying in particular in this issue.
And Wade.
One of the pieces with social media, that sometimes get overlooked is just the notifications. From an educational impact, when you see that little that little red light on your app on your phone, that the attention to those notifications draws you away from what you were concentrating on, what was going on at that moment. So you think of a kid sitting in their desk at school, and as notifications are popping onto their phone, either on a banner or a light, how is that drawing their attention away from what they've been concentrating on or what they're trying to be engaged into? And we know how the brain works. You can't do two things at once. So the number of notifications, the number of interruptions that are happening through the social media notifications, how is that impacting kids from a learning standpoint? But then what about the after effect? Maybe it was a Snapchat notification, that constant wonder of, I wonder what that is. What's going on? What's happening? What should I be knowing? How does that create anxiety and worry with the kid? Yeah. Surgeon General is right on with I believe with the warning, and I think there's a lot of things that maybe we'll talk a little bit more on as we go through here.
What do you tell parents who, you have a 10-year-old or a 12-year-old or an 8-year-old who they want to be on YouTube and they want to do all the things that their friends are doing? Do you tell them, hey, no, actually this is really harmful and it's no social media at all? Is it that easy to say based on what we know? Or, is there a right age that kids can start doing this where it's not as hurtful to their mental health? What do we know about that? Sue, do you know, is there a better age? If you can get them past this age, this is less detrimental, or is it more detrimental, or is it more complicated than that?
It's a little bit more complicated than that. But I think because we know of the harm that it can do, that actually educating children at a younger age about, good practices. There's some great organizations out there that have, materials and things like that for families, which I think are a good thing for them to access. I mean, we know for real little kids, you don't want them on a screen hardly at all. I think that's important, but it starts getting trickier when you're looking at, you know, 5th and 6th grade and things like that. Then you start to see everyone having a cell phone. And so we need to teach kids good habits.
And did anyone else have anything they wanted to add to that? Because otherwise I will go into cell phones as well, because I know that's a big talker. You know, this summer, also The Anxious Generation came out, this best New York Times bestseller book. It was all over the news talking about this, about the impact of kids and smartphones. Obviously, phones having the ability to have internet and kids on their phones. You know, where do you stand? Or I know it may be tough to answer that, but from the medical perspective or from the mental health perspective, what do we know about giving kids phones, whether it's in schools or, you know, at home? What do we know about them having that direct access to a phone, a smartphone specifically in this case, and their mental health? Dr. Gonzalez, if I can start with you.
Yeah, having unlimited access to everything on the internet can be really tricky, right? Because then it's in the palm of our hands. And if we don't teach, like has been discussed, if we don't teach kids how to properly engage with what they can find or what they're actually utilizing the phone for, that can be really tricky. There's benefits, right? Like Sue also mentioned, the connected piece of it with peers, or even accessing telehealth services, right? So there's ways that cell phone use can be really positive. But then we engage with kids if we're not having open conversations of what it can do to how kids portray their lives on social media aren't always accurate, right? And then we engage in that social comparison that can increase those thoughts of anxiety, low self-esteem, depression, right? That starts to kind of increase that negative self-talk, because why don't I experience all of these things when we don't know if that's the reality of what other kids are living too? So it creates ample space for a distorted view on what the world actually looks like if kids have unlimited access without open conversations with the adults in their lives about, you know, a little bit of a reality check.
Feven, have you heard that it can be difficult to ignore if you do have a smartphone, whether that is in class or, you know, in the hallway? Is that hard for today's youth to, even if they know that they need to put it away, is that hard for them to stay off?
Yeah, for sure. I mean, just the start of the school year, as many high schools are banning students from carrying around their phones, I think the always instant urge to like search up a calculator on your phone and like a quick answer to a question that you have, it's knowing that the information is always in your pocket is very tempting to just quickly search it up and find the answer to it. But as we often have all that information all at once, it can be scary because there is a lot of information out in the world that can cloud people's minds and have a lot of anxiety that comes with all the knowledge that you can just quickly search up and find out.
Thank you. And Wade, you know, school districts all over the country have been taking different approaches and stands on where they are going to be with smartphones or even cell phones. Can you talk a little bit about where Minnesota is at in that process?
Sure. You know, I think at this last legislative session, the requirement to have a cell phone policy in every school district was enacted. You know, I think that probably did more towards just creating a conversation than it did in any type of real effectiveness, because I think most school districts already had a cell phone policy. Those have been around for a long time, but it did a great job at creating some conversation around things. You can see in headlines and newspapers and online about schools banning cell phones. I think it's really important to dig into what does that actually mean, because as you dig into a lot of those things, it's not actually, in most cases, it's not banning cell phones from school. It's eliminating them from certain spaces. Then during class time, Is that a time for the cell phones to be off? Is it a time for them to not be accessible? That's where I think a majority of the schools in Minnesota are going to, as you read the articles and you read about the policies that are coming on, you're hearing more about once you enter the classroom, they're going into a pocket, or they're going into a cell phone locker or something of that nature, so that during that class time, there's 50 to 90 minutes of time where kids aren't being inundated by what the smartphone has to offer. And it's also taking some of the wonder. You remember Dan Rooney on 60 Minutes, that he always used to say, have you ever wondered why? That was kind of his catchphrase. And that natural piece of brain development, of just wondering, you see a problem, you wonder about a problem, you think and you wonder through. That's part of our creative being, and being able to look at situations and wondering about possible solutions, rather than going to an electronic device and looking up what somebody else is putting on, or what AI has developed as an answer for you. That's part of our development as people and as individuals. So, creating those times where kids don't have those on them, that seems to be a pretty broad practice that is coming into play this year. You might see more restrictive measures coming from some school districts, but I think that's where most schools are leaning towards right now, as I've talked with my colleagues and visited with other schools superintendents across the state.
One other thing to think about on this issue is the emotional development of middle school and high schoolers, right? Where this is when they start, in essence, pulling away from parents, creating these relationships with people their own age. And if you walk into a lunchroom in a high school and there's no sound because everyone's on their phones, that is really problematic, right? We need students to be able to learn how to develop those friendships, kind of maneuver through them, and really kind of practice those social skills, which you are not going to practice on your phone. And some people on your phone are really not your friends.
There's a question that says, are there resources for adults on how to approach their children about screen time and social media? It can feel a little overwhelming. Dr. Gonzalez or Sue, do you, or Feven, Wade, do any of you know of some resources specifically?
There's an organization that got like $1 million from the legislature, and their name is eluding my brain, but it's about screen time. I'll keep looking for it. It'll come to me, and then I can put it in the chat.
We can follow up in the chat. I liked what Wade, you said, you mentioned the legislation, here in Minnesota. We talked about the book, the Surgeon General's advisory of this starting the conversation. I think about parents who were raising fifth graders in 2012, when we were not having this conversation. They were kind of the guinea pigs of all kids starting to have smartphones. Do you think now, with so much discussion around this, are we starting to see this change a little? Are we seeing more parents having the conversation, being more aware of the dangers on kids' mental health today? Do you think we will see more parents saying, hey, we're going to have a discussion about when you should be getting a phone? Dr. Gonzalez, maybe I can start with you.
Yeah, I think so, right? It's so prevalent, that discussion of, we're even seeing that comparison of even, I don't know, third, fourth graders of, my friend got a phone, why can't I have a phone? And I think parents are, at least the parents that I'm working with, are getting a little bit more savvy as to setting limits of what it looks like in their household. But it needs to really come with an honest discussion of what it means for our family. Right? And are we needing this for safety? Are we needing it because that's the only way that I can get a hold of you because I'm 30 miles away when I'm at work, right? Like, or whatever it might mean. So I think we just really need to hone in on the why, and then have honest conversations too about the impact, and not as a fear-based response for kids, but for them to really understand why they need to be careful when on screens and online.
Feven, you're a junior at Burnsville High School. Do most kids have cell phones?
Yeah, I would say about everyone has a cell phone, And the age variation of when we all got our cell phones, I think is much more different than young people today. But I think the most important part is not when you get your first cell phone, but the first few conversations you have with your parents about the cell phone, because there can be two different people who got the same cell phone at the same age, but how they interact with their phones 5 years after that can be very different because of the conversations they had with their parents. If a parent is understanding of where they're coming from and why they want a phone to connect with their friends, to just be in common with and feel the common feelings of a child with social media, I think that could be much better than not having a conversation or putting blame on the child for them to wait just 2 more years when they really want it.
Thank you so much. I am seeing if we have, I know smartphones and social media could be an entire panel. So I want to make sure that I've answered as many questions on that as I can, asked as many questions, but then otherwise I do want to move on to some more. But if you still have questions on that, feel free to put them in and I will try to get to those as well. But that is a huge, go ahead, Wade.
If you don't mind, this is really, we just kind of had this aha moment recently in our school district, that if you think about when did cell phones in school, which created really the social media burst, when did that become prevalent in school? That was in the early 2000s. So right around that 2002, 2003, you started seeing schools not quote unquote fighting that battle anymore, but rather we're going to teach our students how to use that device in a positive way. In some ways, I look at that as kind of a great experiment that failed. But the intention was good. Fast forward that now to 2024, roughly 19 to 20 years later, the students that were in high school in the early 2000s are now parents of the kids that are in school. They've never known schools without cell phones. They've never known a school where parents don't have immediate access to their children. And our kids in school have never known a time where they don't have immediate access to their parent. When you reel all that back in, I've wondered, in the question that keeps surfacing is when kids are trying to learn how to navigate life, how to navigate adversity, how to navigate experiences, with having a parent immediately accessible to them at all times to answer the question and to give the solution, it eliminates that space for kids to be able to wrestle with those situations themselves or with other trusted adults. And I think it was just a really big aha moment for a lot of us in the administration and staff in our school district, and it gives you a different lens to look at that, the cell phone and the access point too, of our parents don't remember a time when you called the school office to get a message to your student. They just text it or call and leave it with their kids. At our school board meeting this last Monday, our student school board representative was reporting back on some measures that we've taken with cell phones and eliminating them from classrooms. His words were, "It's been very freeing. Our student body has been very accepting of it, and we're having deeper personal interaction than what I remember before." I thought that was an incredible insight from that young man.
Yes, definitely. Thank you. I was just thinking, just even a couple of weeks ago, there was a new advisory about the mental health of parents today. And for all various reasons of how talking about how parenting is different today than it was 50 years ago. And what do we know about the impact of parents having their own mental health issues and the stressors they're facing today? And what impact does that have on their children? Maybe Sue, if you could start off weighing in on that.
Oh, sure. If a parent is highly stressed, maybe, is experiencing depression or anxiety or something, more serious bipolar disorder, that's going to have an impact on their child depending on how they're handling their symptoms. So if they're symptomatic, they might not be able to respond in the same way. So the child's not getting, kind of that consistency in terms of a response that they need. They might feel ill-equipped to really support their child. So it definitely has an impact. And as parents, we need to take care of our own mental health. It's that old, you put the oxygen mask on yourself first, right? You need to be able to do that in order to help your children grow and develop.
Definitely. Anyone else want to weigh in? I'll move on. I know in the report from the Center for Rural Policy and Development, it talked about this shortage of of healthcare workers in the mental health profession, specifically this focusing on rural. But is this something we are seeing both urban and rural in Minnesota? And what strategies are being explored to try to help with this issue? Sue, again, maybe I can start with you to give kind of the broad, overview.
Yes, it's the shortage is everywhere, but obviously, particularly in rural Minnesota, but also in BIPOC communities. A large percentage, almost 90% of our workforce is white. So that also creates, frankly, its own problems. So it was in 2013 that legislation created a summit. And so there was a lot of work that was done, surveys and everything like that. And there has been a lot that's taken place. Some of the more successful things are having loan forgiveness programs for all mental health professionals who are operating or practicing in shortage areas, which is frankly most of the state of Minnesota and certain parts of the Twin Cities. Also looking at knowing that we don't have many supervisors from BIPOC communities. And so we had people graduate, but never actually finish and get their license. So there was a program that actually paid for BIPOC mental health professionals to become supervisors. And so over 250 people have gone through that program, which then allows them, frankly, to provide the supervision to students from, for example, the BIPOC community. There is requirements to have continuing education to become more culturally informed and responsive, which is also helpful. And also looking at, there's a training program at the University of Minnesota training pediatricians and family doctors alongside child psychiatrists to kind of build up their skills, which again could be helpful. And then, even things like we pushed to actually have a workforce center like they do in Nebraska. So we have someone really focused on that, looking at the numbers, how many people are graduating, all of those kinds of things. We have tried to require private insurance to pay for clinical trainees because we thought that was important. That didn't pass, but a lot of health plans are now paying for clinical trainees, and Medicaid and Minnesota Care does as well. So there is a lot of focus on it, but we have a long way to go. One thing I would add just for rural Minnesota is that the supervision can be done through telehealth. And so that actually helps. So you're not driving, 60 miles to check in with your supervisor. You can do that over basically telehealth, which also really helps. So we have a long way to go. That's for sure. I don't know if Marnie wants to add to that.
Marnie, maybe I know you talked a little bit about this at the top in the report, but can you just share a little bit more of the specifics of the workforce shortage and also if transportation is an issue as well?
Yeah, well, I think Sue covered most of it, but for parents and families, of course, for everybody in rural areas, distance is always the big factor that complicates things. It takes more time and makes things more expensive. And so that's always a problem. But like Sue was saying, some of those issues around, paying more for their students who have graduated but are now in the supervisory phase of their education, their hours that they're getting towards licensing. That's really important because, when a student graduates, they have to start paying off their student loans. But while they're still in the supervised period, which can be 1,000 hours or more, they're not getting paid very much. And so that gets to be a disincentive towards these people actually completing the hours that they need to become licensed. They can graduate and go do something else with their degree that doesn't require licensing. And so that's, where that's just one reason that people may graduate but not ultimately get licensed. And that's a kind of a big mystery too, that needs to get figured out one way or another. But for rural specifically, whatever we can do to help students and graduates do their internships and their practicums in rural areas helps, because it's been pretty well shown that students will tend to stay around in a place where they've practiced for a while, including in rural areas. So once they're familiar with the area, there's a much higher chance that they'll hang around. And then, of course, if you can offer those loan forgiveness programs, that helps too.
I'll also add that we already have a workforce shortage, but it's also shrinking, right? And that data is coming out because of reimbursement, right? And people reducing the services that they offer or closing altogether. And so when Marnie talked about that continuum of care, that's really challenging when places that are providing the care can't remain open because they can't sustain a practice, right? We know that outpatient and inpatient mental health funding is the right, sustainable funding is what's needed. And we know that the reimbursement isn't great, right? At its best, it's about 50% of the cost is reimbursed, especially for Medicaid patients. And even though legislative processes did move the needle a little bit on the 2024 legislative session, definitely more is needed to create sustainable practices across the state and just making the services that the kids need, right? Which I think is a piece that's missing.
Thank you. Wade, I want to ask you about school-based mental health services. How have school-based mental health services been implemented around the state, and how effective are those?
You know, referred to earlier, those school mental health programs, there's access to grants, there's access to potential therapists through some of the providers in schools. That I'm going to go two ways with this, Kate. One is, what's the benefit? The benefit is, I think, is huge from the standpoint of, if you have those providers in school, it normalizes that provider. You know, it brings them into the culture of the school. It creates that person as a trusted person within that school environment. You see them in the hallways. You see them interacting with students. You see them interacting with other staff members. It makes them part of that educational world, if you want to call it that. It increases the amount of trust that kids have when they're with that person. It also creates a person where if I'm seen with that person, it doesn't become this, oh, everybody knows that I'm getting mental health services, because that therapist inside the school is interacting in a lot of different arenas. It might be coming into the lunchroom and sitting down at a table and having lunch with kids, talking to them about their ball game that night, having seen them at their play. There's lots of different interactions. So I think having the school-based link is really important from that standpoint. The other piece that I want to go is, I'm not sure that the sole solution is looking just through the traditional school-based mental health link program. We had tried that in a couple of school districts that I've worked in, and we consistently ran up against that shortage wall that was just being talked about. So we did something just a little bit unique. Maybe it's innovative. I don't know. Maybe it was crazy, but we pulled some of our local providers in, our therapists, into the school and presented them with a challenge. We said, you know, folks, we know that students in Montevideo Public School with mental health needs are underserved or not served at all. We know this to be true. So within the next year, we need to create a solution for that. And how are we going to address it? How are we going to solve the problem? And we kind of took the stance of, we're not going to wait for somebody else to solve it for us. We're going to try to solve it ourselves in some way. Those people that came to the table, 6 different agencies came, or providers came to the table, and over the next year had conversation about what could we do as private therapists to help the kids. During that year, the idea of a business model and about money all disappeared. By the end of that year, we had put out we'd come across the goal. And the goal was, how are we going to put a therapist in every building all day, every day, at no cost to kids? And that group did it. Within 1 year, we had private industry stepping up and saying, if you will give us a space to meet with the kids, we'll do it in your buildings. We'll take down those barriers for your parents of having to travel. We'll eliminate some of the issues that come around telehealth get in the way. We'll come to you. We'll build relationships with parents, with kids. We'll provide that service in your school. And I think there are a lot of therapists, there are a lot of people that care about kids, that they just want to see the problem get better. And bringing them to the table I think is a great way to start making a dent in that problem.
Great, thank you. Talking a little bit about, the integration of mental health services with primary care is something that's being explored as one of the possible solution to this. Dr. Gonzalez, I want to ask you, how are primary providers adapting to include mental health services, and what challenges do they face by doing this?
Yeah, so at Children's Minnesota, we have 9 primary care clinics throughout the metro, and all of those clinics have integrated behavioral health providers within their clinics. And what we see is a better flow, right, of patients being identified early, right, before there's a parent that then is showing up in crisis or using emergency departments, right, like the front door for accessing care, because they're being seen and questions are being asked, and it's in a setting where they're comfortable with their pediatrician. And then there's someone that they can pull in with a behavioral health, mental health expertise that can then walk through the parents and even offer visits within the clinic. So we're seeing great success, and what we aim, right, is to continue seeing that happen. And I know that I can only speak to what's happening here at Children's Minnesota, but I know that other hospitals throughout the state have also been considering that and growing their integrated behavioral health programs, which is exciting to see.
Thank you. And looking at, recent legislative action, have there been any specific policies recently or in recent years that have made a difference for when it comes to youth mental health, or any policies that are being explored? Feven, can I ask you first?
Yeah, I think the biggest policy change is the phone ban at schools and school districts creating phone policies. My personal high school is making students not use their phone from the beginning of class to the end of class, but they still have the opportunity to use their phones during passing time and lunch. And already starting school in just 2 weeks, as Wade mentioned, his student representative, there is a growing amount of conversation that's being had during the class period. I mean, just last spring, we had a group discussion, and me included was just on our phone because it wasn't an end point of us not using our phone. So I think we're going to see a growing amount of people gaining more conversation skills and just speaking to each other a lot more.
Feven, did you say that just went into effect this school year, starting last week?
Yeah, just these past 2 weeks, I've seen like a great amount of change, and I think this will increase people's communication skills, especially after COVID happened, as many of us lost our skills to talk to one another.
Thank you. Sue, what do you think of any recent policies come to mind, or any other ideas being explored as far as legislative action?
So one of the things last session was actually requiring more specific mental health education for youth. Our only concern is there's not a lot of curricula out there. that teachers can just pick up and do. We have a program, and we'll come into the schools and do it, called Ending the Silence, but we've done a research to try to find out, some good curricula. So while it's good that the legislature wants this to happen, we need to make sure we have the tools for the teachers to actually do it. I think the other thing, and while it didn't happen this year, almost 3 years ago, is 988. So we have a very easy number now to remember. It's actually on all of the student IDs or planners, so that although not all students understand what 988 is, but it is a great number to call if you're struggling with your mental health or worried about a friend or something like that. I think there's also been a lot of focus on social emotional learning, especially for our young students, which is really important. NAMI has a booth at the state fair, and so we're there 12 hours a day during the fair. And it was really interesting when we brought the staff back together to say, what was your experience? We asked a lot of the younger kids, like elementary school kids, so what do you do with your big feelings, or what do you do when you're upset? 99% of the kids talked about breathing. And I was just like, I just thought that was wonderful. That's like they're learning that, those kind of deep breathing exercises will actually calm you down. And when we look at prevention, right, learning how to handle your emotions and your feelings is really important. Genetics and lots of other things play a role, but we were all just ecstatic that many kids talked about breathing. And frankly, their parents were surprised as well.
I like that. Thank you. Wade, any policies specific that you think have been helpful?
Again, I think the cell phone piece, again, as I said earlier, I just think it started a conversation, but also some funding pieces that came around counselors and social workers to encourage being able to increase the ratio of counselors to student within school systems. Those dollars became available this past year. I think it was a very beneficial things for schools and trying to create solutions.
And Dr. Gonzalez.
I agree with all that's been said. I'll also add that there's been a lot more discussion statewide about protections for LGBTQ youth and policies against discrimination in general. And I think that's been really important in having kids feel safe, right, within their schools and their community as they deserve to be. Just also highlighting just the importance of openly talking about those topics and protections.
I think I'm going to ask just one more question. And when we do this interconnected series, we're tackling topics that bridge rural and urban. And in this case, this has been called, a national crisis, the youth mental health crisis. But I always ask if you could leave people with one thing in the way that they could be part of the solution. And that might be different depending on the field that you specifically work in. But what would you tell, especially for parents that might be watching or might see this, if someone does a story, how can people be part of the solution to what youth are going through when it comes to their mental health? Sue, I'll start with you.
I guess I would say that you can absolutely make a difference. By talking to your school board members, your county board and your state legislators. I think letting them know your concerns, your worries about teen mental health, talking about what has worked. We know schooling, and we know that school support personnel are an important part of making sure that kids get the services and supports that they need. Just really raising those issues. I'm a firm believer that people's personal stories create change.
Thank you. Dr. Gonzalez?
I'll say that it's a very big myth that talking about mental health increases concerns for mental health. And I would want to say that very explicitly and out loud, right? Parents, teachers, anyone that encounters kids, if you're concerned, if you have questions about a child's well-being, ask the question, right? Educate yourself as to how to create safe spaces, right? If the concern is present, so that then you can best move forward with seeking resources, your primary care provider, in your schools, wherever that may be. But talking about it doesn't make it worse. Talking about it opens the door to accessing care.
Feven.
Yeah, and to go off of Dr. Gonzalez, I think conversation, especially from a parent to their child, is probably the most important thing that a parent can do. And not starting these conversations when you think a mental illness is starting, but beforehand. I know we don't always make it easy, but just knowing that we're there and like a parent affirming that they're there for their child, I think is a very important thing and can help negate any issues of mental illness as they grow older.
And Wade.
First of all, I'm super impressed by the advice Feven's given. One way to go. It underscores a point that I think we really need to be able to acknowledge and see kids for who they are. They're kids. And they're going through a unique part of their life, just like we all went through that unique part of our life. But then some of the things that they're dealing with are just very different. They're things that, as somebody in the chat said, they never went through as a kid, and now they're trying to parent their kids through those situations that they don't have any experience going through, and it's hard. And I guess if I had advice for a parent at this time, it's realize one that you're not alone. That when you start seeing issues, don't try to hide them. Don't try to keep it in and be afraid to seek out additional help. Don't be afraid to have those conversations. It's only when we start doing that will truly destigmatize mental health. And the help is here. It's there for you. I'd also suggest that as adults, we need to embrace our role. As I think what Feven's talking about and what I think a lot of kids are talking about across the state with the cell phones and how it's freeing up personal space and it's freeing up and allowing conversations to happen. Those are coming because people are stepping up and setting boundaries. As people, as we like boundaries, whether we admit to it or not, right, Feven? We do like boundaries. And as adults in our kids' world, we need to not be afraid to set boundaries and help kids, grow in who they are in this really weird time in the world right now, where technology is such a big part of things. And when we do that, it creates opportunities for us to have conversations with kids and be part of the solution. So I'm really proud of where our kids are. With everything that's shot at them every day, the way that the vast majority of them are handling the mental health pieces, the social media pieces, is really outstanding. And we only hear a lot of the stories about when things go wrong, but there's a lot of kids doing things right, and there's a lot of parents doing things right. So if you're a parent out watching this today, you're not alone when those situations come up. It doesn't make your kid a bad kid or anything like that. Let's just get the help they need.
That is the perfect way to end things, Wade. I love that everyone is in on this together, wanting to work on this solution. And I'm trying to filter through, see if there's any more final questions, but it's just everyone's fan club of all of the panelists we have had on today. So I do want to do one more big thank you to our panelists. You all just bring such wonderful perspectives and taking time out of your day. Thank you to everyone who has attended this webinar, this interconnected series. There will be more, so please do keep an eye out from Citizens League and the Center for Rural Policy and Development, and follow them on social media. Please keep an eye out if this interested you for new reports from the center as well. For any members of the media on this call, if you have any specific questions to the report or you need some title clarification, you can reach out to me. My email is kate@mcclungpr.com. I'd be happy to help you. And with that, thank you so much, everyone. Have a great day.